Okay, and we have this all queued up. I have my demo, I have all the things. Great. Okay, and I'm going to pretend like you are a seasoned hospital executive as I walk through this thing. And I guess the final thing I'll say is you'll see here one of the things we really want to do, and actually two things. One, first, huge thank you particularly to Jessica, who has been going through an incredible amount of work to put this whole thing together, as well as Natasha, who really did a ton of work, and Monica overseeing that. This looks, I think, a lot better, a lot different than in the past. And then the other thing you'll see is I'm really trying to make it clear not just who we are, but how we connect with hospitals and what our value add is to them. And so that's going to be, if I do it well, the message. Okay? Thank you all. Okay, hello, hi, we're Oscar. Thank you for taking the meeting today. We wanted to come in and describe a bit about who we are, get to understand you a little bit more, and describe what's maybe a little bit different and unique about working with us. So as background, I always like to show sort of how the company started. So this is actually a copy of our founder Mario's EOB when he had his first daughter, which was about 6 or 7 years ago, and that's really was the start of the company. And you can see this sort of very complex, hard, difficult to understand explanation of benefits for the birth of his daughter. And he got this bill and he said, this thing is so crazy, why is this not being fixed? And sort of kept asking, and nobody had a really good understanding other than that the insurance companies don't explain it very clearly. And so that's really what Oscar started, was the notion of how do we make healthcare simple for consumers? And that's really in everything that we do. And that's really the company ethos. And then when we started along the path and started educating ourselves, we said, okay, how do you do that? Well, the first thing is we realized we had to build a full stack technology platform. And we think we're actually really unique in that regard, in that we're the only either startup or existing incumbent who's really, over the last several years, totally built everything in-house. And the reason we felt like we needed to do that was because there's so many disparate pieces in the healthcare ecosystem that don't really connect. So if you really want to have a clear health history, you need to have not only claims data, but you need to connect that to the lab integrations, and you need to understand how that connects to your telemedicine. And maybe you want to connect that to how people search for doctors, and the care management platforms, and this, that, and the other. And when we assess the pieces that exist through existing vendors and out there in the world, they just didn't talk to each other, and they didn't create the kind of experience that we wanted for our consumers. So we really built that all in-house. So we had that full stack platform. We're really direct to consumer because we want to sort of really engage with consumers rather than sort of via benefit consultant, et cetera. We're obviously a health insurance company. And then what do we do? Well, so we sort of said, okay, we're going to build this thing. We're going to make it simple for everybody's lives. We really do two things. First, we generate engagement with folks. We started to realize if we make life simple, we can engage with them and get them to the higher value healthcare, the better option, keep people who at the appropriate site of care for what they need, eliminate excess care that wasn't necessary, all of those things. And then the other thing we could do, as we started to realize, is we actually not only wanted to funnel all of our technology platform to making life simple for consumers, but we also wanted to funnel it to making life simple for our health system partners and our provider partners. And that is another big thing which we'll talk about. So essentially you have a company that's a health insurance company, but really it's a full stack technology platform built about engaging consumers and making life simple for hospital systems. That's basically what we do and who we are. So a little bit of background on who we are. We were really the first company in a lot of the states that we're in as a startup health insurer. We're the first one in New York in our first state in 20 years. We've sort of gotten some good traction, we believe. People say nice things about our founders. And then obviously you probably heard about our investment from Alphabet, which is the parent company of Google. So we've raised over $1 billion and have about $1 billion cash on hand. And what I think is really exciting for us right now is we're a really exciting time where, frankly, it took us a couple of years to figure out our business model, and I think now it seems to be working. So you look on the bottom right chart, our medical loss ratio has gone from about 120 down to the mid to low 80s for 2018. And at the same time as we've been able to lower medical loss ratio, we've actually scaled our membership by a function of seven or so times over that time period. So we really feel like this is a time where we've got our underwriting profit under sort of in a very healthy way. We're growing fast, and we're really excited about growing this model going forward. The other thing I think I would note is on the bottom right-hand chart, if you look at that medical loss improvement over the last couple of years, it's about 36%. That's about double what anybody else in the individual market had. So yes, the individual market stabilized and prices increased, et cetera, but actually Oscar's underwriting profit more than doubled everyone else's, and that's largely by sort of using this engagement, improving our technology, improving our internal processes to control the way that we manage medical spend. So, what happened? Stand by. Just froze. Okay, couple quick background just on who Oscar is. So, as I told you, Oscar is a consumer-driven health insurance company. That means we sell into individuals, small groups, and Medicare Advantage. Those are really all the markets where consumers are really at the forefront of making the purchase decision, and we think that's really key to how our product works, how we differentiate, and where our value really is. So we're not your commercial large group insurance company, at least not for the next long while. We really want to focus on consumer markets. And now we're currently in 9 states, 15 markets. This year we expanded into Michigan, Florida, and Arizona, and we're excited to continue that expansion in a material way in 2020. So again, this is sort of underlying, so that's sort of the background, the basic background of who Oscar is. We want to say really what is different. And you're going to see 2 things that we really go into. The first is our member experience, how we make it a great experience for members, and how we can work with you to accomplish your goals via our member experience. And the other is, I think, really different than a lot of health insurance companies. We built our whole technology stack to make it friendly and collaborative rather than antagonistic with providers. And so you see it's really a different way of operating. And we think both of those are really essential if you're going to have a successful product in individualized healthcare markets. So on the consumer side, this is something we're really proud of. These are some basic engagement stats that we've generated Oscar, and blue is Oscar and gray is the industry as far as we've been able to triangulate it. And our engagement is about 10 times what the average health insurance company is. So that first bar is the percentage of members who engage with us either by phone or digitally in the week before they go to the emergency room. So you can imagine 80% of people are working with us in the week before. Some of that's asking about their benefits, some of it's tracking their steps, some of it's telemedicine, whatever it may be. We have 62% of members are actively using it every month. That's almost double the amount that actually have claims, which is a really remarkable stat. We have more than half of the folks on our platform regular on mobile. That other stat there, care routing share, what that means is 42% of members, when they go to find a new doctor, use Oscar to find it. And that's either a specialist or a primary care doctor. And we think that's a really unique lever, which not only shows engagement, but also trust. And then a telemedicine, the last one, being about 10 times the industry average. And so the question, I know what you're all thinking, is, okay, Oscar's for these cool, hip millennials. But actually, when you look at it out of the non-catastrophic plan, our next biggest increment of membership is the members 55 and above, 55 to 64. We don't yet have Medicare. And those folks engage with us at pretty much, just a little bit lower, but pretty much the same rates as all members do. And we think that's a really powerful thing, particularly as we get into other populations such as Medicare Advantage. Stand by. I'm going to go here. Great. So, okay, and so that's some of the engagement, but what does this actually mean for you, and how would you actually, what does all that engagement stuff mean for you as a health system partner? Well, the first is that we're able to build sort of exclusive and narrow networks around you as a health system in a way that is way better than everyone else. I'm sure you've seen some of our competitors who've gotten sued for having networks that don't quite meet adequacy standards but don't actually deliver all the care. or you can't find the provider data, or it's just a really bad experience. So the average narrow network net promoter score is below 0. Ours is about 45. And what that leads to is that our member retention is over 10 points higher than the industry average. And we think that's a really powerful thing, because it means if you're going to choose a partner, you want to go with the partner that can really have a great experience and retain membership in a narrow network. And we think that's really good. Another stat offhand, in our mature markets, about 30% of our members are word of mouth, which I think is unheard of for health insurance companies. So we think we've got something that can help you grow membership. The other thing we can do is we can use all this engagement to make sure care gets to the right point in your health system. So we work with the Cleveland Clinic, and they have an issue where a lot of their main campus hospital is all full, but the community hospitals are not. And they have a lot of care that really doesn't need to be at the Central Academic Medical Center, that could be at this place. And we find a lot of health systems have folks who shouldn't be at this place that are that aren't really optimized for that site of care. And so we can really help do that and really move the needle. And the last is, again, we feel like we have, as you've seen on those MLR charts, we feel like we can manage a lot of care that in a much more efficient way, which allows us to be more price competitive, which again allows us to get more membership in this narrow network product for you. Here, this is our telemedicine cost of care, and you can see where on other telemedicine services, about 10% of all calls go ER urgent care, and our go to about 2%. So we're really able to manage that population a lot better. And then, so that's the member side. On the provider side, here are the things. We also think we have a differentiated experience as well. So we pay claims a lot better and faster because we built our claim system in-house. We think the industry is above over 2 weeks to pay claims. We auto-adjudicate over 90% of the time across all of our providers, and on average pay in about 5 days. This is stuff we're working with Cleveland Clinic on and a few others, is how do we actually just remove all of the administrative burdens that doctors hate, that hospitals hate. So we're working on gold carding and removing prior authorizations, and that's something we can discuss working on. And then the other thing is we really work together and say about plan design and pricing, and this is across all of our markets, Cleveland, but also everywhere, is we say, hey, where do we want to be? How do we want to compete in this market? How do you want to design the benefits, the premiums, all of those things? And that's a really transparent process of how we do business. So, so again, we think that it's that member-facing side, and then also the back end really being built to work together well is what really differentiates us. So what I want to do is give you sort of a run-through of the actual demo and what it looks like under the hood, and how some of these pieces really connect. So, and Jessica, do I just do the QuickTime? Great. All right, so what we're going to show now is the Oscar app. By the way, for folks here at Oscar, I think it's actually really, you should have the Oscar app, use it. It's a pretty fun way to see what we're actually doing. So here we go. Here's the Oscar app, and you can see we want to keep life really simple. You've got, and we'll show some of these key elements. The first thing is we wanted to help people find care, so that's our equivalent of the Google button. The Google search tab is just Find Care Now. You'll see you can talk to a doctor for free, our concierge teams, which I'll talk about, and then on the bottom is all of the basics like your health history, your lab history, pharmacy history, anything like that. So I'll just start by clicking Find Care Now. And let's say I have a health issue, and I'm going to sign in. Great. And so I'm going to Find Care Now, and I have a health issue, and this is the one Mario really likes to do, which is what it hurts when I pee. Which is always a fan favorite, but not the disease, the typing in. but it shows you it shows you just sort of that everything in the details is consumer friendly, that you can type in what you really have and it'll meet you halfway. I won't go through that one, but maybe I'll instead just pick asthma for the sake of the demo. And here you can see it automatically gives you a notion of what your various care options are. And you can talk to a doctor for free. That's and it gives you a notion of exactly which setting would be more or less affordable for you. So let's say I choose a doctor on call. These are our employed doctors. This is our own in-house built telemedicine platform. We started off actually outsourcing some of this to Teladoc and have moved it all in-house, except for a little bit of overflow. And these doctors are in various different states, but are basically Oscar captive primary care doctors. We're talking and in conversations about how we might actually integrate these more actively and or have health system primary care doctors on these platforms so we could really get a really integrated care model, which we think is really exciting. And and then it's very simple here. So if I want to, let's say I'm going to request a call here. Again, allergies and asthma, I'll skip the description and I will skip everybody taking a photo of my lungs for the time being. I can select a pharmacy right near me. Let's say I want to pick the CVS across the street. That's great. And I won't hit request call, but I'll get a call in 5 to 10 minutes and boom, it's that simple. And so, okay, that's my sort of the first piece we have is telemedicine. The other piece we have is finding a doctor. And so this is if I click, I want to find a physical doctor, I'll put in my own house here, which is 70 West 3rd Street. And I'll see you there at the after party for the holiday party. And so I can just scroll down and let's say I want to see and you can see in all these results, you have photos, you have information about reviews, the percentage of folks that have positively reviewed them. Interestingly, we have about 25% of all of our claims result in a review, which is like Uber and Lyft levels of that, and it's, again, shows that engagement that we have. So we get thousands of reviews a month, and it gives a sense of when they would actually be available. So I can then, let's say, click on Dr. Rahman here, and again, it gives rich photos, gives information about the person's practice, their location, et cetera. And then I can actually here look at Dr. Rahman's schedule and I can book an appointment. Here we do this via both direct integrations with our electronic medical records as well as an in-house built app that allows us to reserve inventory. And again, it gives you all the information about whether I'm a new patient, so you don't have to go with your pencil and paper and fill out information about who you are at the doctor's office, all of those things. And I won't book an appointment, but I could just boom, click it, and then I would be there, and then that be there next Friday. And then the last piece I wanted to show here is our concierge team. And our concierge team is really, I think, really critical to the success of Oscar. And what we've done is most health plans have sort of really operationalized around very specific efficiencies. So you'd have one person that would deal with your bill questions. Other person might help you deal with prior authorizations. Another person would deal with this thing. And what we really felt is that missed the ability to build a connection with the members. And so we have Mario here is on my concierge panel. We have to fix that. Anyway, so each member gets assigned to a panel, and that panel actually is literally geographic specific, so they'll know the subway routes near their house, they'll know who the great doctors are, how to get around that neighborhood, all of the issues that come up, they'll really know. And that will and we succeed when you call in, 75% of the time you get Mario or Chelsea or Maddie or one of these people. And this team, by the way, is 4 care guides and typically 1 nurse. Again, that's another thing we should fix here. And the nurse helps sort of triage all of the clinical questions that arise. And then the care guides, which are sort of our pool of talent there, is like social workers, will help them really understand their needs, help answer any of the other non-clinical questions that come up. And we think that's a really powerful thing. About 5,000 members go to each care team, and it really is a huge part of how we build trust, how we actually get people to the right spots. We literally have people who are on their way in a cab to the emergency room and are texting with their concierge team saying, hey, do you think I should go to the emergency room? What's going on? I mean, this happens every week, and we're able to say, yep, you should go, or wait, no, let's go get you into a primary care doctor, we have an appointment next week, et cetera. So we think this is a really powerful thing. And again, you can see here, this is sort of the text messages that you sort of go back and forth with your concierge team. So, and the last thing I want to show here is how you can actually connect all of these pieces. So we showed some of the digital, the general digital history. We showed the telemedicine, the finding a doctor, the concierge teams. And now I want to show, I think, what really some of the cool power is of connecting all of these pieces. And so, again, if you're, just as a refresher, if you remember, this is dashboards. At Oscar, we sort of have dashboards for everything. This is a dashboard that we track to monitor our engagement with various members. And you can see in any given week, 20-something% of any members are engaged with us, whether that's digital, on messaging, they're searching for things, they have, or they're calling us, which is the inbound, or telemedicine. But interestingly, of the members that ended up at the end of the week in the emergency room, as I said, it's about 80% that are engaged with us. And so that's a really powerful tool. And what we're actually working on and what we have is our data science team can then try to do their best to predict who is that 80%. So if you are doing things like searching for emergency room, you might end up in the emergency room. Or if you're calling up and asking for benefit questions about emergency room, you might end up in the emergency room. Or if you are just searching multiple times for, and you've had 3 telemedicine visits or whatever it is, you also might end up in the emergency room. And so that's a really powerful thing because we have telemedicine, because we have the search, because we have the claim system, because we have all of these things, we can tie them all together. And that's really where the power comes into managing health outcomes. And so let me show you an example, a pretty simple example of how this works. So here, this is an internal built tool that we can create messages out to our members based on whatever they are, whatever the circumstances are. And here I'll look, this is one, and it looks like it's complex code, but it's relatively simple. This is just where someone is searching for emergency room. And our in-house clinical segment says that they're at a high-risk clinical segment based on their claims history. And so then what we're able to do is say, hi, whoever your name is, are you still looking for an emergency room? Based on the services you need, you might be able to see a primary care doctor. And so that's I think that's a really simple thing. Our business users can actually literally write this code. It's not like you need to dial up the IT department. They can really just get in there and change this. And then the cool thing of what this looks like is this is what it looks like to our concierge team. So that would then automatically get sent out. And then internally, this is what an internal member services rep would look at. And they would see exactly the same text. Hi, Edward. Are you still looking for an emergency room? Blah, 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 blah. And you could imagine then if Edward types back, you can then, our reps can continue to start the conversation here, et cetera, and help them. And again, if I go back to my screen, this may have frozen. There we go. If I go back here, and I go to my inbox, again, this is the exact same message. So it goes all the way through. You can see it comes right into the user app just like this. And then the user can just click on this link of primary care doctors that was sent to them. And then they can say, oh, okay, Dr. Song has availability in the next couple of days. I'll go on Sunday to go see Dr. Song in the morning. And that'll be a good way to get my issue resolved. And boom. And so that's really how you can see how all of this consumer engagement, it's one thing to talk about needing to build it, but that's why when we really felt like we need to build claims and telemedicine and doctor appointment booking and all this stuff all together so that it really works as an ecosystem. And we think that's really the power, and that's why you've seen our MLR come down, and it's why we think that we've had great NPS and consumer experience. So I'll pause there and ask you whether you have any questions. Good? Jessica, did I hit everything? Great. Okay. Now I'll actually pause there and ask you whether you have any questions. You didn't even need to clap. Was that like interesting and helpful? Was there anything new in that? Did that all make sense? Yeah.
What questions do you usually get from providers?
Let's see. You get a lot of questions I'd say there's one set of questions, and Jessica, you may help, but there's one set of questions that are, I'd say folks are a little concerned about how this will work with their ecosystem. So they may have a telemedicine platform, or they have primary care doctors, and they're a little worried like we're going to go take that all away from them, is one big concern. And there's different flavors like, wait, how do you, I have my telemedicine, or wait, like what primary care doctors are you putting up on that screen? And like, how do you, and are the concierge people like making clinical care recommendations like, here's an antibiotic, or like what's really going on there, and how do I manage the population if you're going to do all this stuff? And we try to tell them that no, our goal is just to like channel the people into the right spots, and we think there's a lot of waste in people getting lost in the system versus getting connected to the right spot. But I would say that's a big one. Folks want to know exactly what we mean by the MLR coming down. How did we do that? Was it just by denying every claim in sight or something like that? So we try. That's why a little bit in that message you see. That's like why I trying to weave in that we did that via other mechanisms, not just denying all their claims.
Other things, one, if they want to know just like our longer term strategies, because there's still people use building a lot, like what do you all, or do you like actually think you're going to get bought or something like that? So just long term strategy, I would say another piece too. Perspective, and so people are curious and what that partnership looks like. And then generally a lot of questions, I think, like scheduling. Just how does that really work?
Yeah, I think that's right. And people ask about Cleveland a lot. So like, I want to do Cleveland. Can I be Cleveland? And then you're like, okay, cool, yeah. You can have an open relationship. Anything else? Yeah.
Yeah, so when you're talking about the integrations with like health records and stuff, to at least open up health records to be visible to her as well as to other entities in the healthcare system. You mentioned like at the bottom part of the app, consumer, they can look up the medical history and stuff like that. Is there a future where Oscar, collects the patient's medical record and like uses office when they're coming in? Now, would you kind of feel, if there are certain blockers where it's like, oh, that system is on Cerner, we can't integrate a system, or
Yeah, so I think philosophically, I'll give you what I would say is like philosophically, we're very excited about the transition towards more open and shared data. We think that's the key to producing better health outcomes. And we've built all of our tools to be incredibly interoperable with all of the different electronic medical records, and have integrated with some of them. Athena, Epic, we've done Epic directly and via the FHIR protocols, and we're working down through other ones, eClinicalWorks, et cetera. What we also want to be pragmatic about what information is actually useful to share and how we do that. And so we sort of philosophically, we would love to have a deep EMR integration where we share all our data and you get all of yours. We also want to make sure that's actually going to impact the clinical outcomes. So we do with everyone, we do risk deals everywhere, and we are very easy and fast on sharing our claims data, and we're happy to do that. And in certain places, such as with Cleveland, we're really integrating that into their EMR and doing things like, we've improved the risk adjustment scores for Cleveland patients by about 11% in the first year, just by piping our data in there and having the doctors actually change the workflows. So we think sharing data is good. We're happy to do that and give you our claims file or whatever. But if we really want to change things above and beyond, we really want to be specific about how we get into what data, what behaviors, how's that going to work. And so that's a conversation we're really excited about. We're obviously doing it with Cleveland, with others, and would love to do it with you. And I think that's both my external and internal answer, pretty much. My internal answer would be like a little bit, we can't do everything with everybody, and like the Cleveland thing's very particular, so we have to be a little bit thoughtful about how much we do on that, but it is true that we are building tools. Like that would be a great thing, but we do have to be a little cautious about how much we do with whom, all that stuff.
yeah, I guess it's good to hear the context of how big of an investment that is, because I think we like. Things that have to change when you come from a tech company, integrating that stuff is not as capable.
Yeah. Well, I mean, I think so let's see. Generally the tech integrations and such are like, depends which one you're doing and how it's going to work, but it's a big pain in the neck is the reality, particularly any Epic one or any new one is hard. And so when we go to health systems, you don't want to overpromise everything, basically. You want to say, we're excited to do it, well, let's talk about it, but not commit to any specific time frame or whatever. Yeah.
That demo is heavy on the ER conversion.
I think it's generally okay. That's one of the things we're thinking of evolving in this, and like having it be more other ways that aren't exactly ER diversion. Generally, I think most folks are okay with having the don't necessarily need more not super sick people in their emergency rooms. They want to make sure that people get into their systems, so it's a little bit more about market share, I think, for the health systems than it is about like getting not so sick people to ER versus urgent care, and they don't really care about that. And so that's mostly the feedback we get, and that you can't hit that too heavily of like, we'll keep everybody out of your hospitals beds. But I think the ER, and maybe I didn't do the best job in this version of it, the ER is an okay one because they know their ERs are full, there's a line, like they don't necessarily need all these people with the sniffles to be in the ER. As distinct from what they do want to make sure is that like those members get to their primary care doctors. Like if sick people, like they want the sick people managed by their primary care doctors so they're in their health ecosystem so that when something really does happen, they really do get sick, they get referred in. And I think that's much more their business model than like, you know, keeping like the population in the emergency room is going to be the population in the emergency room. Yeah. Yeah, well, I think it goes back to some of the things we put in there, which is, I think ultimately there's a few different ways. The first way that we would begin to work with you is, number one, by moving market share to you in the context of a narrow network. And we think we're the best, we're going to outcompete everybody, honestly, because we have a better NPS, because we're able to control the medical spend better. So if you're picking a partner to work within a narrow network setting, we're the one that's going to move the most market share to you. And people understand what market share means, right? Like the percentage of people that go to their system versus the competitor. And I think that's the point I try to hit the most, is that. And then, and on the margin, you can also look at, you know, we're able to, like within your system, help people get to the right spot, not the wrong spot, which we think actually makes things more efficient for you. Like you don't have the expensive settings and not high revenue people for them. So we think that's helpful. And then there are all the other things that I think we can do as we move into a more integrated. I guess the last thing is all the stuff we talked about in the back end, claims payment, make your life easier, all those things. And then as we get more integrated together, you can imagine all the things we can do. As we said, Cleveland, we've improved the risk adjustment scores. We could talk about co-branding. We can talk about how we do warm transfers from our folks to your folk, which can help you either in value-based care or not keep people in your ecosystem. So we think there's sort of the basics of here's a narrow network and we'll make your life easy. That's sort of part one. And then part two is if you want to push the envelope, we think we're also the best person to push the envelope with. Yeah, and what we do there, we can say, we can give facts, and so, but it's also a very good opportunity to hit them over the head with what we want, which is it's dependent on what deal you give us. And so I would say something like, great, thank you for asking about what market share we typically get, or whatever the thing is. You know, we've historically gotten about 15% or so in a new market of the individual market. That's the majority of the lives in year one, just because the individual market's a little easier to crack into. Small group and Medicare Advantage are sort of going to be more gradual, get a couple thousand lives every year. In your context of your city of Chicago, which has 300,000 people, 15% would mean about 40,000 lives or something like that. I'd say that. And then I'd say, but really the biggest determinant is, which we've learned, and we've learned sometimes the hard way, is we have to be aligned and aligned on the economics of the deal. And if we don't go with a product, and this gets to transparency, if we don't go, frankly, with the unit costs that we need to put a competitive product out there, it's going to be 1 or 2% of the market. And if we do, then we can really move the share. And honestly, that's a transparent business conversation we got to have. I don't think anybody wants to do it for 1 or 2%. But if you will really want to go for it and really drive even more at a lower unit cost, we will work there with you. And if you want to just be sort of at market premiums, we think it'd be that 15% type number. But again, that's a conversation, should you want to do this, that we really got to be transparent about on both sides. And we'll be totally open, et cetera. And so it's like, when we're in these things, we're always like taking these questions. I'm like, glad you asked that, let me make my point. That's sort of what we do. Okay? Thank you, everybody.